So we developed this study because we wanted to explore just that question, a question that's explored very often in global health research about what's the impact on the family of a maternal death. And in doing our literature review, we found there's not really many studies in the United States that explore what happens after a mother dies to her infant. And so we have a longitudinally linked data set that we've been developing in Massachusetts now for, well, more than 15 years, and it includes data from 1998 through 2021, which allows us to track people over time. And we can look, because we have the infant deaths and infant hospitalizations linked to the birth event, we can see that what happens in cases where there was a pregnancy-associated death. And so that's the impetus for the study. What we did then in looking at it was find that in Massachusetts over the period of 1999 to 2020, because we needed extra time to look out to a year postpartum to document those deaths, there were a total of 474 there were 474 maternal deaths or pregnancy-associated deaths, and there were some 6,566 infant deaths in that same period of time. And in linking those, we were able to look at what happens to the infants in cases where the mother died and in cases where the mother didn't die and compare those. Now, the prime result of this analysis was that over that 20-year period, the infant mortality rate in cases where the mother didn't die was 4 per 1,000, which is pretty low. Massachusetts has the lowest infant mortality in the country generally. But in the cases where there was a maternal death, instead of 4.0, it was more than 55, almost 14 times higher in the case of maternal death. When the maternal death was accompanied by severe maternal morbidity, which is an array of factors that are documented in the hospital discharge records, the number of infant deaths goes up to 87, or almost 22 times higher than in the case when a mother survives. And so the first part of this was to ask the question, what happens when a mother dies? And the answer is the likelihood of her infant survival is severely impaired to the degree of almost 14 times higher when she dies and 22 times higher when it's accompanied by severe morbidity. Less than you would think, as we controlled for those factors. We couldn't do a multivariable analysis on the infant deaths because there weren't that many that had accompanied a maternal death. There were 27 infant deaths in the case of a maternal death. And so we couldn't do the kind of standard logistic regression you might do to develop that. But even in looking at the tables, the factors that really stand out were actually severe morbidity was the most pronounced one, but also opioid use, which is a serious issue in Massachusetts, maternal opioid use. And then an array of comorbidities and other factors. And then to a smaller degree, maternal age, extended age over 35 or 40 was more likely to be related to infant mortality. But less than we see in other cases when you take into account, obviously, the prime factor being the maternal death. This has been a thrust of all of our research on this. This is a team of researchers been together 5 years working on these questions. And it's that we need to be thinking about maternal death in a slightly different way, that it has implications beyond just what happens to the mother at the time of the birth. I think the two biggest implications are that we need to envision this from the perspective of women's health, that women need to be supported more during their lifetimes, but during the reproductive years, particularly, so they enter pregnancy in a healthier state. And then equally important, once they've had their baby, to continue to focus on them. Because again, in a number of the cases, the mother's death was postpartum and the infant's death was postpartum. And so we have a system that doesn't pay as much attention to women once they've had their babies as before. And we need to really focus on that more intensely. And the other implication is to remind people that we see a waning of interest in maternal health in recent years. It was a very hot issue a decade ago. There seems to be less concern with it now. And we wanted to let people know that you're not just protecting mothers, you're protecting babies as well. And I think the concern for babies never wanes. And so linking those two up becomes an important consideration for policymakers who might have not been as interested in supporting efforts to improve women's health as they had been in the past. The implications go beyond that woman. That tying it into community health care. And I think the key word you said there was physicians, excuse me. The key word you said there was physicians, because we need to be really effective in a transition of care from the birth event to the postpartum period. And we have difficulties with that. We lose women from the system who don't attend their postpartum visits. Now, they rarely miss a pediatric visit, but the focus tends to be more on, I want to take care of my baby. We need to raise the question of how do we support women themselves in their health systems, because that's a prime contributor to the baby's and the infant's health. I would just note the importance of this lifespan approach. The most important finding I've seen in the literature in the last decade was the report by CDC that illustrated the timing of maternal deaths, that only 9% happen on the day of delivery, and that about 20% happen during pregnancy, and more than half happen in the period between the birth and a year postpartum. And once you take that perspective in mind, then you have start to have to think about the woman as a whole here, and by extension, with this research, the infant as a whole, and the importance of supporting the dyad after the birth and supporting the woman prior to the birth.